If you've traveled to tropical parts of the world, then maybe you're aware of the threat of malaria. In this video, we discuss how common malaria infections are around the globe, who's more susceptible to exposure to malaria parasites, what the symptoms of malaria look like, and how you can stay protected. So, how many people get a malaria infection each year? In 2022, around the world, approximately 249 million cases of malaria were recorded. These ultimately led to 608,000 malaria deaths in the span of 1 year, most of them young children in sub Saharan Africa. In fact, in countries where malaria is present, it's the leading cause of death. This deadly mosquito borne disease is considered one of the most severe public health concerns because almost half of the world's population is at risk of becoming infected. Now, where are malaria cases most prevalent? You'll find the most malaria cases in subtropical and tropical countries, including sub Saharan Africa, the Pacific Islands, Central and South America, especially the northern part of South America, and South and Southeast Asia. In the US alone, there are approximately 2,000 cases of malaria yearly, usually among return travelers. But why are tropical areas most at risk? To better understand this, let's discuss how one becomes infected in the first place. The malaria parasite spreads through the bite of an infected female Anopheles mosquito. It happens when Anopheles mosquitoes bite an infected person and then by another person who is healthy, thus spreading this severe disease. People cannot spread it between each other. Malaria transmission can also occur through the blood transfusion of an infected individual, in addition to the use of contaminated needles. Now, what does this have to do with tropical areas? Warmer temperatures, humidity, and rainfall can provide ideal environments for the spread of malaria. Another reason cases of malaria are so prevalent here is that the disease thrives where people lack resources like housing with screens, as well as limited public health measures like testing and treatment. This makes it easier for infected mosquitoes to thrive and spread the malaria parasite. So, who's most at risk? In areas with a high number of malaria cases, children are most susceptible because they haven't yet developed an immunity to malaria. Pregnant women are also vulnerable because pregnancy changes their immunity. In addition, the World Health Organization says that people with HIV or AIDS are more susceptible to this life-threatening disease. Now, do we have natural immunity to malaria? The answer is it's complicated. If an individual has never been exposed to Plasmodium falciparum, the parasite that causes malaria, then on their first exposure, they almost certainly will become ill. However, with repeated exposure to Plasmodium falciparum, that person can develop immunity. Here's the thing though, continued exposure to the parasite is necessary. Otherwise, if that person doesn't spend enough time in malaria endemic areas, immunity wanes and the person is once again at risk. So, what do malaria symptoms look like? Infection can lead to severe symptoms, including fever, nausea or vomiting, diarrhea, coughing or difficulty breathing, rapid heart rate, rapid breathing, muscle aches, and fatigue. For those living in or traveling through malaria endemic countries experiencing any of these symptoms, especially a fever, it is vital to see a healthcare provider as soon as possible. Now, how is malaria diagnosed? To diagnose malaria, a blood test is ordered. It can check for the presence of the parasite, which specific malaria species is present, and even if that parasite is resistant to certain drugs. Depending on the type of parasite the individual has, medication will be prescribed. So, how can we prevent infection and malaria deaths? There are several things we can do to stop malaria transmission. One of the biggest things is avoiding mosquito bites. EPA registered mosquito repellents are the safest bet. Wear clothing that covers your skin. Stay under insecticide treated nets while sleeping and drape them over strollers and baby carriers. Clothing and gear treated with permethrin, an insecticide and insect repellent, is also helpful. For lodging, choose accommodations that will shield you from mosquito bites. If you're sleeping outside, sleep under mosquito nets. Now, why are there no malaria vaccines? The development of the malaria vaccine is ongoing, and so far, researchers have seen promising results. However, in the meantime, a malaria prescription, which is to be taken during and immediately after a trip to any endemic areas, is wise if you're traveling to an area where malaria deaths are high. This is one of the most effective ways to avoid severe illness. So here's why you need a travel medicine consultation. Avoiding an infected mosquito and staying malaria free aren't the only concerns when you travel. There are many other considerations. Does your destination offer sanitary food and water? What about travelers' diarrhea? Are you going to higher elevations? If so, altitude sickness might be a threat. How can you protect yourself and your loved ones? Thankfully, you don't have to do it alone. A travel medicine consultation is the best way to prepare for your upcoming trip and ensure you stay safe and healthy with the appropriate preventative measures. When you meet with an E7 health clinician for a travel consultation, they will advise you on what prescriptions and vaccines are necessary for your trip, in addition to providing further guidance on food, water, safety, and insect precautions. Adequate preparation is key if we want to prevent malaria transmission. If a future trip is taking you someplace where malaria control hasn't yet been established, E7 Health can help. When you work with one of our clinicians, you can travel the world while staying malaria free. Register as a new patient today or contact us and we'll be happy to assist you.